If you're actually working 10-hour days in your medical office and you feel exhausted, it's not your patients being more complicated than everybody else's. It's because you see your entire workflow in a day of your clinic completely wrong. And in this video, I'll show you how to fix it. Hey, I'm Dr. Bart Kaczmarek. I'm a family doctor in Windsor, Ontario. I trained at Henry Ford Hospital. I run several very busy clinics in Windsor. And I believe I'm one of the highest billing family doctors in Ontario per hour, not because I work more, but because I figured out how to do it efficiently. And what I want to share with you today is the mindset shift that worked for me. And I believe that the same thing can do wonders for yourself too. So a resident came to me recently and said, hey, I worked in this pediatric clinic. They're so busy. They're unbelievable. There's so much traffic. It's just extreme, right? And I looked at her and asked her, so how many patients do they see? And she said, 25 to 30. And I looked at her and asked, 25 to 30? And they're drowning? So most doctors jump into the same conclusion. They're exhausted because their patients are more complex than others, because their clinic serves a more unique population. Their work is somehow more difficult than everybody else's. And to be honest with you, medicine is difficult, right? There's a lot of things to know there. But here's the truth. You're not tired because the medicine is hard. You're tired because the way you organize your work is exhausting you. It's not the patients, it's your workflow. Now here's something no one talks about loud. 90% of clinical medicine in the outpatient setting is repetitive, is the same. Same issues, same workflows, same solutions. Most clinics do not use order sets. They do not have any standardization, and they kind of reinvent their custom work about like 50 times a day. And I think that one of the biggest missed opportunities in the clinical setting in medicine today is lack of standardized forms that you can prepare and have patients answer before they arrive in the clinic. And really, you should know what patients are coming for to your office before they enter through the door. No more fishing for information, no more asking, no more waiting for patient to answer once they collect their thoughts, to just have information you could collect before the visit so easily. This thing alone saves minutes per visit and hours per day. I think nowadays in medicine, doctors tend to work like custom cabinet makers. Everything's made from scratch, everything is a custom order. But nowadays, doctors should work like IKEA. They should like modular, standardized, specifically for repeatable problems. And this doesn't make medicine any less professional. If you allow the standardized process for 90% of your issues, then you can focus on the 10% with even more attention. And if you think about it, even patients today want more efficiency. Like, we are used to the world of Uber, Amazon, online banking, so they don't want friction, inefficiency, delays, and waiting in the waiting room for 1 or 2 hours like it used to be okay years ago. And look at the billings. They also don't support this artisanal hand-holding medicine. Technology is begging to be used so the patients and the doctors can all have a happier life. So when clinics say they're busy, it rarely means that their patients are very complex. It just means friction. Flow is unpredictable, so you lose time looking for who's next. Nurses pulled to extra tasks like talking on the phone while she should be doing something else for you directly. Receptionist is juggling too much things. She can't help you with the tasks you need her for. EMRs are not optimized. You have to reinvent the same thing multiple times per day. Sometimes old paper charts are in the picture, and this like life in two worlds is just draining. Simple tasks take too long, well, they could be easier. Nothing is standardized. You have to just put your mind into every single step. Everyone is doing everything, making everything more chaotic, and every step adds to more friction instead of making your life better. Now that's what busy in the clinic means to me today. It's not complexity, it's just lack of organization. There is actually such thing as decision fatigue, right? Whenever we have to have too many decisions to perform a simple task, after several hours, we know that their performance just drops. If you look at the Yerkes-Dodson law, it says that a little pressure is really helpful, but over a certain threshold, that pressure makes the systems collapse. And if you look at a thing called utilization theory, it says that anything over 80% of capacity it becomes unsustainable. And if you look at how we operate in the clinic, often we operate about close to 100 or more. And it's mathematically and scientifically impossible to perform well over this threshold. What works the best, at least for me, is that if everyone works on the top of their skill set. So I believe that doctors should do the most complex things that requires their presence. They should be doing medical decision making, and those decisions should be made with the patient, should explain options to the patient and lead them to the best solution. So doctors shouldn't be collecting information, they shouldn't be digging into basics of the history, they shouldn't be retyping things or typing anything, as a matter of fact. The same thing with nurses. And if I look at nurses, I think they should be triaging patients, coordinating care, refilling prescriptions, reviewing your labs, administering vaccines. And if you don't get a nurse, you better get one, because that's going to make your life really easier when you have all those tasks taken care of by someone that's on your side. And even the receptionists, the final layer of your support, they shouldn't be buried in like simple, repetitive tasks that you could easily delegate to the online tools. I see the role of reception as your direct support, looking through your billings, taking care of complex admin tasks, and freeing your reception from this repetitive work really adds to the value of your clinic work and your flow. Now let me show you an example of two clinics, okay? Clinic A, okay? Clinic A has 2 rooms, 1 receptionist, no nurse, no organized flow, freshly started EMR with no shortcuts, no flow solutions, no customization. The doctor drawing their own vaccines and spending time reviewing the guidelines and making sure the right vaccine is administered. There's 20 patients per day seen. There's like 30-minute appointment slots. The clinic is half paper, half digital. The booking is like a month ahead and everyone's overwhelmed. Now Clinic B, there's like 7 rooms, 2 secretaries and 3 nurses. There is a well-organized computer system. There's a well-organized rooming system. Appointments are 5 minutes. Amount of patients seen per day is 80 to 100. No paperwork taken home. All the labs and prescription refills are delegated. There's online booking and electronic forms. There is an AI receptionist in the front. The doctor is only doing doctor-level work. The nurses are doing nurses-level work, and the receptionists are freed with automations. And the doctor goes home without any exhaustion, feels fulfilled, and feels happy. So what if I told you that those 2 clinics, Clinic A and Clinic B, were the same clinic? It was actually my clinic before we changed how we work. And all it took is we organized our workflow. So I think that doctors aren't burnt out because the clinic is complex or patients are complex or their situation is unique. I think doctors are exhausted because they don't have the right environment to really flourish, to do the best they can, to work on top of the skill set. You don't need to work more. You need to work in a system that supports you. And if you want to hear more about clinic efficiency and how to build a comfortable medical practice, I'm creating videos about it every week. Please subscribe to my channel. See you soon. Thanks.